Smallpox, a comparative study with chickenpox, measles, and influenza. Transmissibility, peak rates, and the last known case for medical students, nursing students, and healthcare professionals. Question: what were the smallpox infection rates at its peak, and how does this compare to chickenpox, measles, and influenza? Answer: at its peak, smallpox caused an estimated 300 to 500 million deaths in the 20th century alone. It was more localized compared to measles, which has caused large-scale outbreaks. Chickenpox has had widespread prevalence but lower mortality rates, while influenza's impact varies by strain, with pandemics like the 1918 Spanish flu causing significant fatalities. Question: when and where was the last known diagnosis of smallpox, and what were the circumstances surrounding it? Answer: the last known natural case of smallpox was diagnosed in Somalia in 1977. An eradication campaign by the World Health Organization culminated in this last case. However, a laboratory accident in the UK in 1978 led to one additional death. This illustrates the importance of biosafety in handling smallpox and other virulent pathogens. Question: how did smallpox's transmissibility compare to other diseases like chickenpox, measles, and influenza? Answer: smallpox's R0 value ranged from 3.5 to 6, indicating less transmissibility than measles, 12 to 18, chickenpox, 8 to 12, and certain strains of influenza. Close contact was usually required for smallpox transmission, while the other diseases could spread more easily. Question: how have vaccination efforts contributed to the control and eradication of smallpox? Answer: smallpox is the only human disease that has been eradicated through vaccination. The concerted effort by the WHO and global partners led to eradication, with the last case in 1977. This contrasts with ongoing vaccination efforts required to control measles, chickenpox, and influenza. Question: what are the clinical symptoms of smallpox, and how do they compare to chickenpox, measles, and influenza? Answer: smallpox presents with fever, malaise, and a distinctive rash that progresses to pus-filled blisters. Chickenpox and measles also present with rashes but have different patterns and associated symptoms. Influenza primarily affects the respiratory system, contrasting with the skin manifestations of the other diseases. Question: how do public health measures for smallpox compare to those for chickenpox, measles, and influenza? Answer: smallpox required isolation, contact tracing, and targeted vaccination. Measles and chickenpox control rely on routine vaccination, while influenza involves yearly vaccination and antivirals. These measures are tailored to each disease's specific characteristics. Further information: smallpox, once a devastating global disease, has been eradicated through successful public health measures. The study of its history and comparison with other infectious diseases offers valuable lessons in epidemiology and disease control. For more in-depth information, consult medical textbooks and relevant epidemiological studies.